Good morning, doctors. Today we are from small group discussion B2. We'll presentate our student project that entitled Preanalytic in Bleeding Time and Clotting Time Examination. But before that, I will explain the member of small group discussion B2, and these are the lists. We hope you can enjoy our presentation.
BT, or bleeding time examination, is the process of prolonged bleeding after controlled superficial trauma, which indicates platelet deficiency, while clotting time, or CT, is the time required for blood clots or the time needed when taking blood until the occurrence of clots. The pre-analytical stage is all activities before the sample is analyzed, including patient preparation, specimen identity, specimen retrieval and shelter, specimen handling, specimen delivery, and specimen processing and preparation. Pre-analytical stage are the most common stage of errors. Errors occurring in the pre-analytical stage can account for 60% to 70% of all laboratory errors, including misidentification and sample problems. Error in the pre-analytical stage generally occur because at this stage it consists of many manual activity. Overall responsibility for errors that occur during testing. The lack of standard procedure for collecting sample at the pre-analytical stage can lead to some clinical consequences, such as error in diagnosing patient and being the cause of error in patient cares. The pre-analytical stage is arguably the most important stage because the pre-analytical stage has a direct influence on the quality of the result and the reliability of the clinical. So accurate standardization is urgently needed at this stage to achieve accurate result.
Now we're going to talk about the problem formulation for this topic. The first one is what is the meaning of pre-analytical phase. The second one is what is the meaning of bleeding time examination. The third one is how pre-analytical and steps in a bleeding time examination. The fourth one is what is the meaning of clotting time examination. And the last one is how pre-analytical and steps in a clotting time examination. The objective of this project are: the first one is to describe pre-analytical phase. The second one is to describe bleeding time examination. The third one is to explain pre-analytical and steps in a bleeding time examination. The fourth one is to describe clotting time examination. And the last one is to explain pre-analytical and step in a clotting time examination. The benefit of our project is we hope we can expand our knowledge about pre-analytical in bleeding time and clotting time examination, and we will know about the meaning of pre-analytical in general and pre-analytical in bleeding time and clotting time examination. And the last one is we will know steps of bleeding time and clotting time examination. Now, we're going to talk about the pre-analytical phase. Laboratory examination is an important stage in stabilizing a diagnosis, giving medication, and other evaluation to support medical treatment. Laboratory examination consists of three main stages, namely pre-analytical phase, analytical phase, and post-analytical phase. Pre-analytical phase are all steps that are carried out before the sample is analyzed in a laboratory.
Now we are talking about the pre-analytic phase, and there are several important things. The first one is preparation of the patient. It is providing information about the action to be taken, the benefit, the objective, and the other. The second one is providing specimen identity. It is crucial because the information is related to the specimen to be tested later. The third one is collection of the specimen. It is considered about the time, the volume, the location, the technique, and equipment. Next is specimen processing. It is according to the type of a specimen. It's like urine, blood, serum, and the other. Next is storage of the specimen, and the specimen stored with addition of certain preservative so that the specimen are not damaged. And the last one is delivery of specimen to the laboratory. It is accompanied by a complete label and request form, and the specimen delivered is as fast as possible.
Hello, my name is Xian Luis Ong, and my last three-digit number is 42. So the first one is bleeding time. Bleeding time is a general test to determine the platelet function and its quality by measure aduh jelek kali. Hello, my name is San Luis Ong and my last 3-digit number is 42. So the first one is bleeding time. Bleeding time is a general test to determine the platelet function by measuring the coagulation time inside the body. And the basic theory of this test is to see the length of blood clot from the incision, or when the incident starts bleeding, until the termination or the blood stops. And the objective of this test is to make the medical team sure that the surgical can be appropriately done and give information about non-specific infection. So other laboratory tests are needed to support the diagnosis. This test is divided into two primary methods based on the length and location of the incision, called IV method and Duke method. And furthermore, it will be explained by others.
Next, pre-analytical and steps in bleeding time examination include preparation of the patient, patient identification, collection of specimen, specimen processing, storage, and transport of specimen. Next, okay, preparation of the patient. So we must confirm the patient if they're not taking anticoagulant or aspirin because it makes the bleeding unable to stop. And if the patient have previously to taking it, so they must stop and adjourn the bleeding time test for 3 until 7 days. Next, patient identification. So we must asking the patient about their full name, date of birth, medical record number, until identification of their specimen because it aims to ensure the patient data and avoid medical errors. Next, collection of specimen. So the specimen was taken from the capillary blood of the patient. For IV's method, use capillary on forearm, and Duke's method use capillary of the earlobe. Next, storage and transport of specimen. For the bleeding time test, unneeded storage or transport specimen to the laboratory because the blood is only allowed to drip while doing the counting until the bleeding stops.
Now, I will explain the tools and materials that used in bleeding time procedure. There are two methods in bleeding time procedure. The first one is Duke's method. The sample is capillary blood, the target is on earlobe, and the normal time is 1 until 3 minutes. The second method is IV's method. The sample is capillary blood, the target is on forearm, and the normal time is 1 until 7 minutes. There are some tools and materials that used in Duke method. There are cotton with antiseptic, disposable sterile lancet, filter paper, and stopwatch. There are also tools and materials that used in IV's method. There are cotton with antiseptic, disposable sterile lancet, filter paper, stopwatch, and also sphygmomanometer.
Right, next we're gonna explain about steps of the bleeding time. First, the E5 method. First, patient arm positioned as high as the heart, then raise cuff pressure until 40 and keep the pressure maintained at that level. Next, cleanse the area using alcohol. Using a standardized tool or device, make a 1 mm tip and 10 mm long slice or incision. Blood the blood 2 times in a minute, counted using timer. And then last, stop the timer when there is no more bleeding when loaded and noted. Reduce method. The first and second step are the same. See, cleanse the tip of the finger or earlobe using alcohol. Make incision with a sterile lancet. Next, blood the blood 2 times in a minute, counted using timer. Last, stop the timer when there is no more bleeding when loaded and noted.
So now let me explain about clotting time. Basically, clotting time is the duration from punctured blood vessel condition into fibrin thread formation. It is also defined as the interval time for blood to clot. The normal value is around 3 until 8 minutes, which shows the platelet quality in interacting with blood vessel wall to perform blood clotting process. Clotting disorder may bring to a serious bleeding or clotting problem. That is why clotting time examination is needed if there is any symptoms such as easily bleeding or bruising, unusual blood clot formation, blood in feces or urine, and heavy menstrual period.
It is also suggested for those who have several diseases, such as bone marrow problem, lack of vitamin K, liver disease, leukemia, and also immune system disease or before surgery process. There are several types of clotting time examination method. First is capillary method, second is object glass method, and last is modified Lee and White method.
So the next one is pre-analytical and clotting time examination. The first step is preparation of the patient. Before the examination, patients should confirm that they are not consuming anticoagulants or aspirin. If they are, they must stop, because anticoagulants or aspirin prevent blood cells from clumping, resulting in bleeding that cannot be stopped. Therefore, the test should be postponed. The next step is patient identification. Some variables such as patient age, gender, race, blood group, and health status are contributing in hemostasis testing. Proper patient identification and the test method are important for proper result interpretation as prevention of potential misdiagnosis. Then the next step is specimen collection. The blood samples may be collected by the searing technique, and it is usually obtained from peripheral vein and collected in glass or plastic tubes that contain buffered trisodium citrate as anticoagulant. Proper blood collection also affected by proper trained personnel.
And now I'm going to explain to you the storage of specimens, specimen transportation and stability, also tools, materials, and procedure. So, transportations and the processing of blood specimens are important variables and have a large impact on result, which can turn into serious consequences for patient care. The sample stability time, temperature, and in what conditions based on the assay are usually used to indicate stability criteria of the specimen. And some tools and materials that we need in clotting time are 4 pieces of test tubes for the size of it, and then stopwatch, water pad, and 1 milliliter of blood for each tube. So here are some procedure of each method in clotting time that can be explained by my friend.
Hello, my name is Amanda. I will continue to explain about clotting time test method procedure. The first one is Lee and White method. That has been recommended by the Brazilian Ministry of Health as the standard for clotting time examination. Firstly, blood were collected with a plastic unlubricated syringe without any coating or anticoagulants. As soon as the blood tube was filled with the blood, the timing started by using a stopwatch. The tube was left untouched for 5 minutes, and every 30 seconds slowly tilted the tube to see if there's any present clots formations. For normal value for this method is 6 until 12 minutes. The second one is capillary tube methods. Firstly, blood was collected by puncturing a finger up to 3 mm deep with a disposable needle, and then slowly drawn the blood into the tube by applying non-heparinized capillary tube with the capillary actions. The timing started by the blood starts to appear in the tube and afterward at interval of 30 seconds until a jelly-like material indicates coagulations. Number of broken pieces of the tube multiplied by 30 seconds was considered by the clotting time. The last one is light methods. It use fresh blood droplets that require 2 drips of blood and spread into a sterilized glass slide. At interval of 30 seconds, it will be lifted with a stick to check if there is any blood clot formation until the fibrin filament is visible.
The last one, I will tell you the conclusion and also the suggestion. For the conclusion, clinical laboratory is a health laboratory that provides examination services for supporting disease diagnosis, disease healing, and health recovery efforts in many medical fields, including hematology. One of these examinations is bleeding time and clotting time examination. Like any examination in general, this examination also has 3 important stages, which are pre-analytical, analytical, and post-analytical stages in each method that must be implemented properly and carefully so the examination can be executed well. And for the suggestion, the first one, the application of the method in BT and CT examination can be customized based on the necessity and availability of the tools and the sample. The second one, the implementation of the 3 important stages of the examination, which are pre-analytic, analytic, and post-analytic, should be done properly and carefully to avoid the misleading of the result. The third one, in performing this examination, we also need to pay attention in such condition or disease that can affect the result of the examination. I think that's all from us. Thank you.